So when any of the near or dear ones of a family member is admitted in the ICU, it's important for the next of kin to know certain facts, because there are a lot of myths and falsehoods that are built upon a patient getting admitted in the ICU. First and foremost, you have to understand that patient is not very well, may be critical or may be slipping towards becoming critical, and that is the reason the patient gets admitted into the ICU. So what do we do as doctors in the ICU? Two things. One is we treat the patient and of course support and monitor the patient through different kinds of organ support systems. It could be breathing support on a ventilator, it could be support for low blood pressure, it could be dialysis in case the kidney is impacted, so on and so forth. So the gamut of care includes diagnosis, treatment, and most importantly supporting these patients, and of course a very, very close watch on these patients as well. Of course, it's a huge amount of emotional and psychological trauma for the patient who is inside the ICU. So as families, I think it's important that when you go into the ICU to say hi to the patient who is there in the ICU, it's important that you give them the necessary moral strength and of course participate and cooperate with the medical team to ensure that the treatment goes on, and most importantly the necessary emotional support is given to the patient. I know it's easier said than done, because when one of our near ones is in the ICU, it's always very, very scary. But I think as family, that's the least we can do to help them, and there are different ways of support that we can offer from the institution and from the ICU resources as well. We have a team of counselors, we have additional social workers and a trained set of nurses and doctors who will help you in the process of giving the necessary support to the patient, and of course helping you as well to get through this difficult phase. But most important is to remain optimistic as much as we can, and of course stay with the medical team's decision in helping the patient to get better. Thank you.